If we could now pass over to Dr. Christina, if you could give us some insights from your perspective.
Okay, thank you, Mr. Andrew, and good afternoon, everyone. So for the PPP, I'm very agree with Mr. Vijong because we know that for now, government always have the budget for the health, right? But it's very limited, and it cannot cover everyone. We have to learn from our previous COVID-19 situation in Indonesia that we see, even though we have a lot of hospital or health facilities, it cannot serve everyone. So, yeah, actually by the PPP, public and private partnership, it will share the risk, and actually the private sector usually will have the innovation and expertise better. They can bring many expertise and technical knowledge that can be applied in the field. So, for example, in the COVID situation, we know that a lot of patients cannot come into the hospital because the hospital is very, very packed. And yet, the hospital in urban area, they still send the patient to us. But because we don't have the robust healthcare system, and then it's very limited, we have to think that the investment opportunity, one of the things is, if you ask what can we invest in the near future to have the preparedness of the next emergency, I think we need to have like we need to build like the mobile ICU maybe, or mobile emergency that can place anywhere, not only in a central level in Jakarta maybe, but we can deploy in anywhere so the patient can be treated there. And then I agree with you, Miss, because with this COVID situation, a lot of critical and then a lot of metabolic disease is re-emerging again. So it's very important to emphasize that the promotive and preventive action needs to be focused on. And then there's a lot of things that we can do in this field, because most people do their investment in the curative field. In the promotive and preventive field, I think it's less than 10% who focus on that area, but that's play a big role to build a robust healthcare system, because if you do your preventive and promotive action well, then the cost of the health can be reduced, and it can be used for effectively for the research and development, so we can have a preventive next action for the next emergencies like that. Thank you.